A partial knee replacement is a selective resurfacing of the arthritic part of the knee. Many patients, in fact the majority of patients, will have arthritis that's fairly well localized to only one or two parts of the knee. So rather than performing a total knee replacement, which is the traditional approach and still the approach that most surgeons would use, and this is a total knee replacement here, we can actually go in through a smaller incision and more selectively resurface only that part of the knee that has arthritis. We can preserve normal cartilage of the knee. We can preserve the critical ligaments within the knee joint. And I think that's the main advantage and one of the reasons why our partial knee replacement patients recover so quickly. Functionally, our partial knee replacement patients tend to do better. They can return to the sports that they were performing prior to surgery at a greater rate than our total knee replacement patients can. The level of satisfaction after a partial knee replacement is greater. The surgical incision is smaller. There's typically less surgical pain associated with the procedure. And patients are usually only hospitalized overnight, and sometimes they're even discharged on the day of surgery. There's less surgical risk, there's less risk of complications. And ultimately, the durability of a partial knee replacement, when done well and when using implants that are designed well, can be the same as the durability of a total knee replacement. Well, the ideal candidate for a partial knee is a patient who has very localized arthritis affecting only one or two parts of the knee joint, who has still a pretty good range of motion. In other words, the knee hasn't become so stiffened by the arthritis process that it's difficult to restore an adequate range of motion. Patients tend to have localized pain, so the entire knee isn't painful, but the pain can be localized to one part of the knee or another. And I think patients have to have realistic expectations. They're undergoing surgery, and even though we have expectations that the recovery will be relatively rapid, there's still some discomfort associated with surgery. Patients have to be willing to take some time off from work. But I think given the right candidate, it's a wonderful option for our patients. Typically, patients should make an appointment to see a physician when the knee is hurting. They don't necessarily need to see a surgeon right away, but I think it's time to see the surgeon when patients feel that the non-operative treatments that they can entertain are no longer providing them with adequate relief. So when medications or physical therapy programs or activity modifications or injections or a variety of other interventions fail to relieve their pain, that's when the patient should come and see the surgeon.